Today we're going to talk about breast reductions for both women and men. Joining me now is our plastic surgeon, Dr. Elie Levine, and Dr. Jody Levine, our dermatologist. They practice together on the Upper East Side in Manhattan. Welcome back. Good to see you guys again.
Good to see you too.
So always people associate plastic surgeons with, augmentation, putting in breast implants, but you do a fair amount of reductions as well. Talk to me about that.
Yes, so it's actually a very common procedure. People come in, they're concerned about their back pain and shoulder pain and all kinds of other symptoms, and really what they benefit from is a breast reduction.
Right, getting the heaviness out of there. Jody, you actually see people that develop problems from, besides the back pain and the shoulder pain, skin problems.
Yes, I'd say yeast infections or rash from yeast under the breast is very common in people who really need a breast reduction.
Okay, so how old are the patients that you're seeing for this? I would imagine that they're kind of on the younger side.
There's such variability. There are patients that are coming in that are 18, 19 years of age, and very rarely even 16 or 17. And generally, those are patients that we try to push off a couple of years till they're a little more mature. But there are a lot of young patients, or patients that are coming in that after they've had children, they may be in their 30s or 40s, and even people coming in their 60s and even 70s that say, you know what, I've lived with this all my life. I really don't want to deal with the back pain and the heaviness anymore.
Wow, that surprises me that they would come when they're in their 60s and 70s. Let's look at some surgeries there. Here you go. Tell me about what you did here, Elie.
So, there's a limit to what we can really show on television.
Right, of course.
But you can get a sense that not only is the volume reduced, but the breast itself has been lifted up. So it's no longer that heavy burden that's lying on her belly. It's raised higher up, and it helps improve the symptoms dramatically.
Okay, and we have some others. Come on. Okay. Now, I'm sorry. Is this covered by insurance?
So typically it is covered by insurance. As long as a patient has significant enough symptoms, the insurance will typically cover this.
Okay, here's another one I was talking about there.
And it's also very similar, where you can just see that the breast has been lifted up, reduced, and the before picture you can see that most of the breast is lying on the upper belly, and afterwards it's lifted up significantly.
Okay, and I think we have one more. There we go.
And
wow, that's pretty dramatic.
Yes, this is even more pronounced, and this is someone who you can understand really. This is a burden. This is not something that society now puts this glorious, ness about the chest, but in a lot of patients, it's a lot of difficult situations for them.
Okay, now a lot of people think of women with breast reduction, but men can develop breast tissue as well, right?
That's
Jody?
right. I started off my career actually as a pediatrician. And I can't tell you how sad it is for these teenage boys who are afraid to take off their shirts because they're embarrassed of their breasts.
Right, and the condition is called gynecomastia, or what a lot of people call man boobs, right? And you can help those people as well.
Right. So depending on the severity, sometimes it can be as little as doing liposuction, and sometimes it requires removing excess skin as well. But it dramatically changes the shape, and it allows people to take their shirt off in public settings and feel a whole lot more comfortable with who they are.
Right, now we have a number of before and afters right there popping up on the screen. One of the things, though, people have to understand, too, is that you got to be careful you don't take out too much, right?
Correct. You don't want to create contour issues and problems that you can't really hide. The women, for the most part, aren't showing their entire chest. They're showing portions of their chest, so they can camouflage and hide things. Men, if they really want to take their shirt off, can't do that, and because of that, it really needs to be very precise at work.
Yeah, wow, that's pretty dramatic. Wow, that is tremendous. Jody, what kind of response these patients get, once they get fixed? They have to be like, they must be hugging you guys.
It's true. It changes their life. They have so much more confidence. They're so much happier.
All right, guys, so tremendous work. Thanks so much for coming in.
Thank you.